Welcome back to Doctors on Call. We're talking tonight about the importance of eye exam with Doctors Kathleen McCabe and Susan Beck. If you missed any of our show or would like to share this valuable information with friends and loved ones, you can watch an encore presentation of local Doctors on Call Sunday mornings at 10:30 right here on SNN Local News. That's 10:30 Sunday morning, local Doctors on Call right here on SNN Local News. And we're back. I'm Wendy Mann-Resnick with Doctors Kathleen McCabe and Dr. Susan Beck. And if you'd like to ask a question of either of the doctors, just give us a call at 361-4675. We'd like to hear about your questions and your issues with your eyes. And it doesn't have to be just about eye exams, but any issue you might have with your eyes tonight. So, Dr. Beck, if I have 20/20 vision, does that mean that I have healthy eyes? You know, when I was a kid, oh, I have 20/20 vision. That's what we all used to run around and say.
Right.
Does that mean we have healthy eyes if we have 20/20 vision?
Unfortunately, no. I mean, it's a good start, but it's better than not having it, I guess. But it does not mean that, unfortunately, that your eyes are healthy, because just because you think you can see well, and I say think you can see well because people think that they can see well, and then you tell them to cover an eye, and they say, who turned out the lights? I see nothing. A lot of people, there's something called amblyopia, where one eye develops a lot more than the other eye, and with both eyes open, you have no idea until you're forced to cover the one eye, and you realize, oh, I don't see so well. So that's an issue that we look for. There's something called strabismus, where one of your eyes actually turns in or away, and each eye could see 20/20, but your eyes are not working together, they're not teamed together, they're not focusing together. Also, you could have an incomplete focusing system where you're seeing 20/20, but it's a huge effort to get there, and that leads to headaches and eye strain. Children have that, like I said, oftentimes they're able to overcome a huge prescription by pumping in all this focusing power, and that can lead to headaches and learning disabilities. And then as you get older, your eye naturally declines, that you do lose your focusing ability. So again, you know, it's still not a perfect system. And again, just because you see 20/20 does not mean that you don't have other issues that are underlying inside, like cataracts, glaucoma, or systemic disease, lots of other
You can really
things.
see 20/20 with pretty advanced glaucoma, actually.
Yeah, that's true.
Yeah, you wouldn't think so. And people think, oh, I see just fine, I can't possibly have glaucoma. But really, glaucoma takes your peripheral vision first. And you can have a pretty significant peripheral visual field loss and not realize it, because we are binocular, and if you've lost that left side of your visual field in your right eye, your left eye is taking over for you, and you may not really realize that. So sometimes people see 20/20, but their visual field is like a little tunnel. They can see what's directly in front of them, but nothing in the periphery. And once you've lost that vision from glaucoma, there is nothing we can do to recover that. That is why probably the number one reason that we see people on a yearly basis is because it is a completely silent disease. You will not know you have it, and that damage cannot be recovered. So it's all about prevention, and you won't know we need to prevent it unless you come in and we take a look.
It's pretty scary.
Well, I don't mean to be that scary, but it's important.
Well, it is scary because you just always think, well, gee, I can see perfectly fine. So,
Right, I know.
Well, that's right. Just go in, let the expert tell you, and then you can leave an hour later knowing that for that year you can at least say, yep, I got perfectly healthy eyes, until the next year rolls around. Then get it checked out again. Just
so-
put it on your list of your yearly things to do.
But if you have a healthy eye exam and everything is just swell, you know, by the time you go next year, could something have happened, you know, in the first 6 months, or how long does it take for
sure.
something to all of a sudden, like, wow, I can't see now?
Oh, things can happen. Now, take for example glaucoma. If something happens where you've developed a high pressure or pressure that is damaging your optic nerve, we will see just the early signs of that if you come back in a year. So just like Dr. Beck said, if we catch those things early, then we can do measures, we can do treatments that will preserve the vision that you have. So it's all about, you know, nipping it in the bud. Now, if you see something that has suddenly decreased your vision, or something that you perceive as different sometime before that year comes up, don't wait till the year comes up. Come in right away, because that's abnormal. There isn't anything that should be taking your vision away suddenly. And there are some very serious things that need treatment immediately, that if they're not treated, even the space of a week, sometimes even the space of a day, can cause irreversible damage. So if you see a change in your vision, don't, so I can't tell you how many times, and today even, for instance, I had a patient who 10 days prior noticed a decrease in her vision, and she thought, let me give it a few days and see if it gets better. It's not like when you have a sore knee and you say, maybe I just slept funny or I stepped funny and maybe it'll get better. If you're seeing differently, there's a reason, and it is always better to come in and have us take a peek and say, oh, your eye was just a little dry or something, rather than miss something that we should have treated a little bit earlier.
So if you call the office and say, I've got all of a sudden my eyes aren't working like they should, how fast do they need to get in, and can they get in that quickly?
They can, yeah. Any
It's an
sudden
emergency.
decrease, any sudden decrease in your vision, painful, not painful, something that you've noticed significantly different over a short period of time. Actually, the shorter the period of time, the more of an emergency it is, actually. And then we would want to see you that day, even.
And you just need to convey that to the front desk, whoever answers the phone. Some people maybe call and nonchalantly say, yeah, I don't see so well, so I'm going to come in. And we say, okay, how's next week? And then it turns out that it was much more serious, but the person on the phone didn't really feel comfortable explaining the emergency. There are no silly questions. You can never be too extreme or too careful when explaining what is the problem when you're going to make your eye exam. If you feel that something has just happened, then you just need to tell them, this has just happened to me and I really feel I need to be seen, and you'll be seen that day. There's no question.
Yeah, I think a lot of older people feel like they don't want to bother anybody.
Exactly. I don't
My
know how
mother was
many
that
times.
way.
Yeah, they say, "Oh, I didn't think it was a big deal. I asked my friends if it was okay, and they, no, just ask me. Call me on the phone, email me, whatever you want.
Dr.
I will
Beck
give you."
actually knows the answer to that
Yes.
question better than Aunt Martha or whoever.
Yeah,
who
exactly.
may have an opinion, but Dr. Beck will be a little bit better at answering that.
Well, and if you have a question, we'd love to hear your question. Just give us a call at 361-4675. We're here to answer your questions. They are, actually. I'm not. And Dr. Beck, what other kinds of diseases can you see when you're examining the eyes?
Well, it's amazing the amount of diseases that we can see. We can, starting like Dr. McCabe said, just lesions on your eyelid, purplish red lesions could be HIV. You could have cancer. Further into the eye, we can also detect kidney problems, we can detect brain tumors, we can detect multiple sclerosis, we can detect evidence of a stroke, and not to mention the common ones of diabetes and high blood pressure. So it's the hyperthyroidism, hypothyroidism. The list is endless of what we can see inside your eye. When they say the eyes are the window to the soul, they really are, and the windows to your health, for sure.
And how do you do that? I mean, how do you see all that in the eye exam? That's fascinating to me.
Well, we have some really cool and nifty technology
Yeah.
and tools, thank goodness.
That
So-
don't hurt, most of them.
Yeah.
So people are impressed at how much we can do without them being subjected to pain or needles or discomfort.
Or
Yeah,
anything really
it's
scary
kind of fun.
either. It's
Yeah.
not scary, and we do have bright lights, so you will see some bright lights, and we have some powerful microscopes. And so a lot of what we do is just using something called a slit lamp, which is a powerful microscope with a light source. And that light source is in a thin beam of light. And so since part of the tissues of the eye are transparent, putting that thin beam of light off to the side actually gives us a cross-sectional view. And so we can see all the layers of your cornea, all the layers of the lens in the eye, through that gel in the back of the eye, and we can see what's going on in those tissues too. So it's if you like teeny tiny little things, ophthalmology and optometry are the field for you.
You need good eyes.
That's
Yes.
true.
For sure. Well, we're going to take a break right now, but stay with us. We'll be back in a minute. And welcome back to Local Doctors on Call. I'm Wendy Mann-Resnick, and I'm with Dr. Kathleen McCabe and Dr. Susan Beck, and we're discussing eye exams and all the things that you could find out about yourself through your eye exam. It's really quite fascinating. But if you have a question about your eyes, whether it's about an eye exam or just your eyes, just give us a call here at 361-4675, and the doctors will be happy to answer your your questions. We were talking about the diseases of the eye and things that you could see when you were examining them. And my question to you is that when your eyes are dilated, can you see all those kinds of things that those illnesses and diseases?
Well, some things are more prominent on the surface of the eye, and so, you know, looking at, there are actually some even obscure diseases that we can see that affect the surface itself. But many of the things we're talking about as far as seeing the blood vessels and what's going on in the gel in the back of the eye, those require your pupil to be dilated, mainly because those lie behind your iris, and that's the colored part of your eye. So some things on the surface, some things in the back.
Interesting. Interesting. And so what are the symptoms of cataracts? Because I hear about cataracts all the time, but I really don't know anything about them. So what are the symptoms of that?
Well, most often it's when you start to notice that your vision's becoming a little bit blurry. Maybe it's a little harder to read, a little harder to see the ticker tape that happens on the bottom of the news when you're watching the news. Harder to read street signs at night, those kinds of things. And oftentimes people think that they just need a change in their glasses. And the early stages of cataract, that usually works, changing their glasses prescription. But as time goes on, as I like to say, you start to see either we can't change your glasses sufficiently to sharpen up the vision, or you might have other problems like glare and halos, where at night when you're driving and headlights are coming towards you, it's hard to see, or the sun, when you're driving towards the sun, makes it really impossible to see. Sometimes it's hard to read street signs because the glare from the street lights is so difficult. And here's a really big one I hear all the time, especially from male golfers, is that they used to be the guy in their group who could spot where everybody's ball went, and now when they look up into the sky, as soon as it gets into the sky, they get some glare, and they can't follow their ball, and everybody else has to show them where it is, and they don't like that. So,
Oh, I'm sure not.
yes, so it's usually that either glare and halos or difficulty focusing and seeing fine details. So those are the two common things anyway.
Interesting. If you have a question, give us a call at 361-4675. We'd love to hear from you and your questions. And so macular degeneration, can you have cataract surgery if you have that? Would that be helpful?
Yes, in a lot of circumstances anyway. Macular degeneration does affect the fine vision. It's a weakness really to the central part of the retina. It's everything that it's the part of the retina actually that lets you read and recognize faces. And when you have macular degeneration, it starts to take that away. You know, it's quite possible you will develop a cataract too, because that's kind of the same age that both of those develop. Now, we do look, just like the patient Larry who called, we always weigh, is it the cataract, is it the other retinal pathology that you have that's more important, or if they're equal, or the cataract is a little bit more important, then we want to maximize the vision that you have, even if it's somewhat compromised from another problem. And in that circumstance, of course, we would take your cataract out so that you could have the best vision you can have, even if it's not perfect vision.
This is a very fine art that you both practice here. and it's really very fascinating, all the information that
making the patient happy and healthy is what our goal is, because just because I tell you you have a little bit of a prescription, if you're happy with how you see, then you're happy with how you see. I care about is, are your eyes healthy? So you might choose to not wear your glasses or see a little bit better, but it's good to know every year that you don't have any disease processes going on. So that's, like I said, also the point of an eye exam, not just getting new glasses.
And Dr. Beck, where are you located so people can find you?
Sure, I'm at 3920 Bee Ridge Road, which is on the corner of Bee Ridge and Sawyer, Building A, Suite A. And you can check out our website, beeridgevisioncenter.com, like us on Facebook, and you can call our office at 9233411. I don't call it that often. So.
But I'm sure our viewers would like to
Yes.
call. And Dr. McCabe, where are you located at?
And we're also on Bee Ridge, a little bit closer to 41, right in front of the mall at 2111. We are the white building with blue lights at night, and you can reach us at 941-792-2020, and we'd be happy to see and hear from you.
Well, thank you so much, ladies, for being here
Thank you for
tonight. It was
having us.
very informative. And we'll see you next week on Local Doctors on Call.